afternoon and welcome to another exciting edition of the National Science and Maths Quiz Mentorship Sessions for the 2020 year. The National Science and Maths Quiz Mentorship Sessions set a platform for our giants in the science industry to discuss the impact of COVID-19 on their various industries, as well as share their experiences with the students as a way to encourage them. The mentorship sessions are proudly sponsored by Absa Bank Ghana Limited, with support from Dano Milk. Thank you very much to our sponsors. We are live on our Facebook and YouTube channel at NSMQ Ghana. So for today, our guest is Dr. Ifwa Odi Abrahams. She's a lecturer at the University of Ghana Medical School and a consultant pathologist at the Kolebu Teaching Hospital. She holds a fellowship in laboratory medicine of the West African College of Physicians and the College of Physicians and Surgeons. She also belongs to several professional associations. She's passionate about teaching and learning and the practice of pathology. Thank you for joining us this afternoon, Doc.
Thank you very much.
You're welcome. So basically, we are going to be looking at what the COVID-19 pandemic has done to your industry and what you do as a person and what the National Science and Maths Quiz means to you personally. But then there will be a few other personal questions here and there that I will chip in as and when. So please, can you tell us a little bit about yourself and what you do as a pathologist?
Thank you very much for this opportunity to share some thoughts with the students. As my name has been mentioned already, I'm Ifwa Abrahams. I'm the youngest of 3 daughters.
Okay.
And I attended one of the all-girls schools that's competing in the taking part in the competition this year.
Okay.
But I will not reveal it just yet.
Please, we want to know.
You will know. You will get to know eventually.
Okay.
So I studied science in school. I did my GCE O-level and A-level. And then after that, I gained admission to the University of Ghana to study science. At that time, you couldn't gain entrance straight into the medical school.
Okay.
We were all admitted to do biological sciences.
Okay.
And so at the end of the second year, level 200, there was a short list with an interview. And then after that, I gained admission to the medical school.
Oh, okay.
I enjoyed my medical school education very much. Eventually, I qualified after 6 years of studying as a doctor. And then I spent 1 year doing my housemanship in Kolebu Teaching Hospital.
Yeah.
After that, I was employed as a medical officer. But I wanted to specialize in pathology, so I chose to work in the Department of Pathology at Kolebu.
Oh, you had the opportunity to choose where you wanted to work?
Yes.
Okay. Okay.
At the time. Things have changed now.
Yeah.
So I was employed there, and while I was working, I specialized in pathology.
Okay.
And I did my training under the West African College of Physicians.
Oh, okay.
And eventually, in 2010, I qualified fully as a pathologist.
Oh, wow.
Since then, I have been working as a lecturer at the University of Ghana Medical School.
Okay.
In the Department of Pathology. And my work as a teacher really is to teach primarily the medical students, pathology to the medical students. But in addition, I teach the nursing students, veterinary medicine students, as well as allied health students.
Okay.
And
so is that on the side or is it part of your description?
it's part of my job description.
Okay, okay.
And then I also work as a consultant pathologist at the Kolebu Teaching Hospital. And that's a lot of work. It involves examining human cells and tissue.
Yes, I was just coming to ask about this. Can you tell us what pathology is? I mean, to a layman, how would you describe?
So in very simple terms, pathology is the study of diseases, the causes of disease, how the diseases come about, the structural changes that occur in the body, in the organs, and then the functional effects of those structural changes. And so we examine cells and tissue from the human body. And we get these specimens from surgical procedures that are done in the hospitals. Yes, and we examine them to determine what disease process is taking place. We make a diagnosis, and then we offer other information that will help the doctor looking after the patient to choose the best treatments for the patient. Yes, so That's basically what pathology is. As part of my job description as a pathologist, I also have to train others. So I train other doctors who want to specialize in pathology like I have done. And then we also conduct research.
Okay, so can you tell us a little bit about the training process for these other doctors?
Yes, so once you finish your medical education, you are required to do now 2 years of housemanship.
Okay.
And you can do the 2 years in a teaching hospital and then in a district or regional hospital.
Okay. That's so 1 year here, 1 year here.
Exactly.
Okay.
So that you get the experience of working in a tertiary facility as well as at the primary or secondary level.
I see.
And then after that, if you have the opportunity, you can apply to join the postgraduate medical program of the Ghana College of Physicians and Surgeons. Nice. And so once they apply and they take an entrance exam and they pass, then they have to attend an interview and be accepted into the training program.
Okay.
The training takes in total about 5 years.
Wow.
So for 2 years, they're training to become a specialist, what we call a member of the college.
Okay.
And this training involves being able to examine tissue and to identify the changes, the disease processes and the changes that have occurred in the organs.
Wow.
And then after that, they take an exam, become specialists.
So
and then they have to train.
Exam and interview, they do another exam at the end?
After 2 years.
Oh, after 2 years, okay.
And then they continue with their training and then take another exam at the end of another 2 years.
Wow.
And then you're fully a pathologist.
Wow. So currently the doctors that are working with you, that are being trained, how long have they been in training?
We have people at different levels.
Okay.
We have some who are in the final year of training. We have some in the 3rd year, and we have some who have just entered the program.
Okay, so do you have any who have completed the program?
Yes, yes, we have several who have completed the training and are working at different places in the country.
Great, thank you for helping our doctors. Okay, please, why pathology? Of all the various disciplines, why pathology? Why does it interest you?
All right, I get that question quite a lot because it's unusual for a woman to do pathology. And so I get that question quite a lot. But when I was in the 3rd year, that's when we do pathology as a subject.
Okay.
And I liked the fact that it explained diseases. It explained how the diseases came about, what are the causes, how do the causes interact with the body to bring about the disease, what are the changes that occur in the tissues, and how does that affect the function. So I realized at that point that I was interested in the hows and the whys of disease. And subsequently I had the opportunity to do an elective program in pathology in the United States, which piqued my interest. No, it was at the end of the 5th year. It's a program that is done in the medical school. We have an exchange program at the end of the 5th year. And so I saw pathology being practiced as a profession, you know, where the samples would come and then the tissue is prepared and slides are looked at, the diagnosis is made, and I fell in love with it.
Wow.
So while I was continuing my education, I was considering that as an option to specialize, and I haven't regretted my decision. I enjoy my work.
I'm happy to hear that, yes. A lot of people, after a few years in the profession, they start to feel like maybe I should have done this. They made a mistake, Yes, I'm happy that you enjoy what you do.
I do.
Yes. Now, can you tell us what your biggest dream is in the field of pathology? What would you like to see happen, especially in Ghana here, where you practice it? What is the biggest dream that you have to see go on in the field of pathology that will make you super excited?
What would really excite me, and that's what I hope that by the time I'm retiring, that is what would pertain.
Please, how many years before retirement?
Oh, I have quite a number of years. I have almost 16 years to retire.
Wow, okay.
I hope that by that time we have pathologists working at least every regional hospital in the country.
Okay, do you know what the numbers are now?
Now, I can tell you that the areas where there are pathologists working really is Kolebu, Komfo-Anokye. We have 1 or 2 pathologists at Ho, not at Ho, sorry, at Tamale, Cape Coast, 37. And then I think 1 person in Ridge.
In the whole of the country?
Yes. And then there are few in private practice.
Then you're very few.
We are very few. Okay, but thankfully we have quite a number of trainees now.
Okay.
And so what I would really love to see is that all the regional hospitals have several pathologists.
Yeah.
And that the field of pathology is progressing. Doctors and the public understand what pathology is. And we can contribute our share to the management of patients in Ghana. That is what would really excite me.
Yeah. I really hope that this dream comes true, because we can't have such few numbers all across the country.
Yes.
That is very dangerous for us.
Yes.
Okay. What are some of the advantages of pathology? I know that we might have teased out a few from the little that you have told us, but the major advantages of pathology to us as a country, to the medical school, to UG, can you share some of them with us?
Yes. So you cannot really study anything in health-related professions without pathology, because that's the basis of disease. Okay, so it's a very important subject as far as training people for the health professions is concerned.
Okay.
And as far as the practice of pathology, every tissue that is removed from the body needs to be examined, so that we can come to the right diagnosis and be able to treat the patient appropriately. And so everywhere that surgeries are being done should have a pathologist, because otherwise the care is not really complete.
Okay.
And now what happens is the samples will have to be sent to a place where there are pathologists for that examination to be done.
Samples have to travel.
Exactly.
Wow. How often do you have that happening at your place?
We receive samples from all over the country, and even from neighboring countries. So every day we get samples, and some of them are coming from the north, from west, east, south, everywhere. Some come from Côte d'Ivoire, some come from Togo.
Wow.
So pathology is very important to the health care of the people.
Okay.
And to UG as a university, an educational institution, all the health professions require that they are taught pathology. So it's a very important subject. And with the research that we do, the information that we provide from the research guides choice of treatments, guides management of patients, and so on. So it's very important, not just for...
So you work hand in hand with the doctors who see the patients?
Yes.
Okay, that is a very good one. So now going to COVID-19, which is the talk of the whole, I don't know, world, yes. How has it affected your industry? How has it impacted what you do?
It's, as you said, it's affected everyone, really. And as a lecturer, the university had to close suddenly at the beginning of the pandemic. You would recall that the University of Ghana was shut. And thankfully, at the time, we had completed most of our lectures, at least in the Department of Pathology, for the medical students. But for a while, there was no engagement with the students until the university was able to roll out the online studying platform. And so when that was done, we were able to complete the lectures with the other students. We had to change the way we do things. Exams had to be done online, and therefore the format had to change. We all had to learn how to use the online platforms. And then as a pathologist, we really had quite a bit of impact, because we receive, samples from the surgical procedures. And because of the pandemic, the hospitals were not working at their full capacity, which meant that we're not getting enough samples. That affected the quality of training of the residents, the doctors a bit. And then also it meant that patients who ordinarily would have gotten the surgeries and then the examinations that they required, they had to have their surgeries postponed. We perform autopsies as well as part of our job. And there was a huge impact there. We had to close down the service for a while because the protective equipment was in short supply at the time. So
just for the autopsy? For the autopsies.
So, and some people die, you don't know why they have died, which is why we perform the autopsies. And it could be COVID, so you couldn't really take any chances. But eventually we were able to get enough protective equipment, so we resumed resumed the service.
But when you resumed, did work go on as quickly as it used to? Or were things slowed down?
Not really. Before, we would do autopsies every day. But now we do autopsies twice a week because we want to kind of conserve the protective equipment.
Okay.
So we will book the cases for the week, and then we will do all the cases in 2 days.
Oh, okay.
Usually on Wednesdays and Fridays.
So do you do just as many cases but only on 2 days?
Yes.
Okay. Wow.
But it means that the reports are kind of delayed. I mean, if you could have gotten the reports on Monday, because we won't do the autopsies on Monday, you have to wait. Yes.
So the next set is done.
Yes.
Wow.
So there has been an impact, and we are trying to manage the best we can to ensure that the work goes on.
Okay. So you mentioned exams having to be done online now, and I want to take us back a little bit. Can you tell us what your experience has been with that? What do you think the students are doing? Are they being loyal to their, honor code about not cheating and all that? What do you think? Have you had to mark any scripts so far? And what do you think?
I have had to mark some scripts, and it's either that they were copying or copying one another, or copying from a common source. Okay, so perhaps they were using the internet because some of the answers were more or less verbatim. And that is a big challenge. With the medical students, we actually did the exams face-to-face. We asked them to come in. We had to use 3 exam halls so that we could maintain the social distancing. Okay. But with the other students, we did the exams online. Okay. And we did notice that there was some untoward activity going on.
Would you say that the nature of the questions generally were more difficult or easier, or the standard was the same as it would have been in person?
I think the standard was the same.
Okay.
The standard was the same. We tried to maintain the same standards, yes. Some of the questions were multiple choice questions, and others required that you would write a short essay of some sort, just a few lines, answers. And that's the same kind of exam that we would give, if they were there in person. So the standards were maintained.
Everything is still the same?
Yes.
But you believe that they were cheating?
I think so.
Because some of them are students you've taught before in person, right?
Yes.
So you can sort of tell what their performance is usually like.
Yes.
As compared to this one, and you can see that there's a big difference.
There is.
Wow. Okay.
For some of them.
Okay. If you had the opportunity to pick another profession, anything, whether in the sciences or in the arts or anything, what would it be?
I think I would probably have done interior decorating. It's kind of wide apart, isn't it?
Yes.
But that's something I enjoy doing.
Yes, give us a little bit of explanation for this one.
So I like to decorate.
Okay.
I like to arrange things. I like things to be just so perfect.
Okay.
And I do that even on the side. I've even looked into taking some courses online in interior decorating, something that I enjoy. And I suspect that if I hadn't done pathology, I would probably have done interior decorating.
Wow. So now, even as a pathologist, do you sometimes do that?
Not on a professional scale, no.
But just in your home?
Yes.
But do you do it for other people? Do you help them decide what to use for what?
Yes, I do that. Friends, yes.
Wow. Can you give us an example of a time where?
I had a friend who was moving into their new home. Okay, so I helped them select their furnishings, curtains, carpets, etc. Where to put what, yes.
Okay. Okay, now let's get a bit into family life. Yes. Do you have any children, please?
Yes, I have 2 children.
2, okay.
14 and 11.
Okay. So back to COVID. How has it affected the family space now that they're not in school or going to school and they're in the house with you? How has that worked for you?
Very well. Actually, I like it when they are home. So it's given us an opportunity to spend more time with them.
Oh, aren't they always on their phones?
No.
Wow.
I don't allow that.
Wow.
So we've had the opportunity to spend time together.
Okay.
And it's given us also the opportunity to teach them some things that need to be done at home. You know.
Like the chores and things that
Yes.
they usually do not do.
Because they are not home.
Yeah, that's a good one.
Yeah.
Thank you very much. So please, can you tell us some of the things that helped you along the way, becoming a pathologist? As a student, as a fellow, what are some of the resources that built you up along the way and helped you to get where you are today?
The best resources, I think, we're all human. So my family, my parents, really, because they taught me to be hardworking and to be focused.
Okay.
And that really helps, because with science you need to be disciplined and you need to work hard.
Yeah.
Okay. Then they also supported me a lot when I was doing my specialist training by looking after my children. You know, so
yeah.
they would pick them from school, they would look after them, and I'd just have to pick them up from there on my way home. They would have been bathed and fed.
Wow.
Okay, so they've really been a big support. Yeah. And then I think my teachers. It's very important to have good teachers. And out of the lot of good teachers, it's very good also to have mentors, people who encourage you, who guide you, who give good advice. And when I was in the 3rd year, one of my pathology lecturers, I approached him and told him I was interested in pathology.
Okay.
And he followed me up throughout. Every now and then he would call me and ask me about what I was doing and if my interest was still there. And when I was going to do my electives in pathology, he introduced me to a colleague of his from medical school days here, who was working in that hospital. Okay. You know, and now I work with him. He's one of my colleagues at work. So you need, throughout my training, he was mentoring me. He supervised my work, my dissertation, and all that.
For your undergraduate?
For my postgraduate.
Postgraduate, okay.
Yes. So you need mentors, and I've had good mentors, and people who believe in you.
Yeah. So
those were, I think, are the best resources. Yes, you need good facilities, I suppose, like educational materials and so on, but I think the best really are the human resources.
The human resource.
Yes.
Okay. Thank you very much. So one of our listeners, Teiko, I hope I got the name right, wants to know what the difference between a pathologist and a lab technician is.
Okay, so a pathologist really is a medical doctor.
Okay.
You have to train as a doctor first, because what you are doing as a laboratory physician or a pathologist is you are giving information about the disease. So you have to understand the disease, and you have to be able to provide the information that will help your colleague doctor to manage the patient. Okay. The effect of the disease will differ depending on what other things are going on in the patient. Yeah. And you need to understand that to be able to advise properly. Okay. A laboratory technician understands the test processes, knows how to conduct the test, and generates the results. Okay. Can troubleshoot what's going wrong with the test and correct it. Okay. And generates the result. But the interpretation of the result will have to be done by the laboratory physician, yes.
Okay. Wow. Thank you very much for your question. Okay, so going on, do you have any advice that you would give to somebody who wants to go into your field? Especially the females.
Yes, well, I suppose the advice is for everybody really in the sciences, because science is very broad and there are many pathways that you can take. I think the first thing is you should choose what you are interested in, because that's going to be what you'll be doing for the rest of your life.
And you have to enjoy it.
You have to enjoy it. Okay, so choose what you are interested in, and as you go through your education, think about what you're doing, look at your strengths, what interests you, and then based on that, make a choice of what you want to do. And then be prepared also to work hard and to aim for excellence. You have to be thorough with what you do. If you're going to do something, you might as well do it well.
Well, yes.
Okay, so that's the advice I would give, that they need to study hard, take the opportunities that they get, and make the best of it, and aim for excellence. And finally, build your character, really. Develop your character. In honesty, be a person of integrity. Keep your word. Be trustworthy and reliable.
Even as a doctor, all these are very important.
Very important. Wow. Because employers these days are not really interested in your skills.
Your skills. Okay.
It's about your character
and
whether you are
people.
trustworthy. Yes.
Okay.
Yes. So that's what I would say to anyone who wants to follow a career in science.
Okay. And can you give us the process that you go through, maybe to become a pathologist? Where do you start from before you get there?
You have to start with science. You cannot be a pathologist without doing
science from high school?
From high school.
Okay.
From high school. And then you have to get into medical school because you must be a doctor to be a pathologist.
Okay.
Okay, so that will take you 6 years of training in medical school, followed by 2 years of housemanship now.
Yeah.
And then another 5 years of training to be a pathologist. Yes.
Wow.
So that's the process. It requires a lot of stamina and determination.
Yeah. If you don't necessarily want to become you're just doing it for somebody, you will not
be able
won't
to
do
go
well.
through the whole... You will not enjoy it. It will be tedious.
Wow. Thank you very much for your time, Doc. This has been exciting. We will find a way to continue this another time. Thank you very much. Do you have any loved ones that you would like to say hello to?
I guess my family, and I have a large family. So my family in Nana Krom, in Legon, and in Hatcho. And then my colleagues at the Department of Pathology. I'd like to say hello to them.
Dr. Abraham says hello to all of you. And thank you very much for your time with us this afternoon. This has been the 2020 edition of the National Science and Maths Quiz Mentorship Sessions. Our mentor for today was Dr. Abraham, who is a pathologist at the Kolebu Teaching Hospital. I am your moderator, and my name is Amma Dugan. Thank you for joining us today. See you again next time.
COVID-19 has changed the world, but despite the challenges, the spirit of Africanacity is still alive.
Thank you for
it's in the tenacity of the men and women keeping us going. It's in the creativity you use to work, teach, and do it all. And it's in the ingenuity of all those who are making a difference. Thank you to everyone still getting things done. Your Africanacity inspires us.
Choose Dano Milk for your family because 100% of our milk is sourced from our farms, taking great care in every step to ensure the milk that gets to you is of high quality. So build your strength every day with the goodness of Dano Milk. This advertisement has been vetted and approved by the FDA.